So I wanted to introduce Maria Miskovic. Did I say that right, Maria?
Yeah.
Miskovic.
Miskovic. It's ick.
Okay, Miskovic.
I guess.
That just how it's spelled exactly.
That's it.
She's with Care Choice Care Management today. Maria is a licensed clinical social worker who's worked with multiple care settings over the past 27 years. She's worked in hospital management and case management roles for medical and behavioral hospitals for much of her career. With early roots in home care and long-term care, her hospital experience rounded out by working for an elder care attorney with a life care planning practice. And as a social worker interested in gerontological issues, the need for care management of elders, disabled, and mental health populations became apparent. So Maria started Care Choice Care Management 10 years ago, and congratulations on that, and is enjoying the ability to practice in a client-centered fashion with multiple master's levels care managers on staff and an ability to help people of all needs navigate the healthcare system through their multidisciplinary team. Care Choice Care Management is one of the leading practices of its kind in the greater St. Louis area. Maria contributed to chapter 35 of the Life Care Management Handbook, which provided valuable content to the nonprofit care management model. So let's go ahead and get started with our interview with Maria.
Thank you.
So first question, Maria, you have so much experience helping individuals and families, and we know that professional care managers are often from a healthcare or social services background. Can you share with our audience the benefits of the social worker can bring to the industry and how you feel social workers can find success with helping others in the care management role?
Sure. Well, I mean, I think for social workers are resource experts, right? So, I mean, generally that's specific to the area they work in, and demographically, they are the ones who are supposed to be able to help people through the continuum of care. Obviously, a lot of social workers have experience with community-based resources or healthcare-based resources, and they focus on. We're trained as social workers to always keep the client first. So from that standpoint, a care manager is also trained the same way, and that is something very important. It comes up a lot, especially in care management where you have sometimes family members hiring you. But there's, the client is actually their elder loved one or their disabled loved one. So that's something from an ethical standpoint that social workers really inherently understand. So I think they're really perfect for a care management role. And certainly they round out that medical perspective, because personally I love practicing with nurses as well, because then you get both perspectives, but social workers I think bring to the table all of the skill sets needed to navigate through that healthcare system.
Yeah, I love how you say the round, bring it around, and work together with a team approach. I've worked with a lot of social workers myself throughout my career as a nurse, and I tell you, I wouldn't have gotten by without them. A valuable team player, and I agree with everything you say, making an excellent care manager professional. So my next question is, I'm going to read from my paper since my prompt has lost having the power outage here. So here's the question I have for you. For anyone new or interested in care management, there may be limitations in the understanding of the typical client. Your experience includes working in behavioral and mental health. Can you help understand the way in which care managers can help diverse clientele, including those with mental health conditions?
Sure. I don't think that, I think that obviously people come in all shapes and sizes, right? Most care managers work with the elder care client. However, mental health, especially now, since the pandemic, is a huge aspect of care, whether you're working with elderly or adults or young people. So, I mean, for me, mental health it was one of the ways that I was able to really boost my practice, because here in St. Louis, there's a number of care managers, but there were a lot that didn't have any expertise working in mental health. So I actually, when I first started, a majority of my referrals were coming from other care managers. I think it's a personal choice. It's definitely, when you choose to practice, you can practice however you want. But there's a huge need out there. There's a huge gap in services for the mental health population, for populations that have intellectual disabilities, developmental disabilities, as well as the elder care population. So I think, your opportunities are great. And the more you can diversify, the better your practice will be. The more successful, the more clientele. And honestly, to get businessy for a second, elder care can kind of go up and down throughout the year. Mental health goes like this. Well, actually through the pandemic, it definitely went up. But, from a cash flow standpoint of managing a business, mental health is a steady stream of income, because everybody needs it. There's all different ages.
Yeah, and I feel like it's needed ongoing also. Like it's not like some people are in crisis mode. You get them out of the crisis and steady and they're done. In mental health, like you said, it's ongoing.
Right. Yeah. I mean, you always need to circle back and stay focused on what the goals are to keep that person in a manageable lifestyle. So, and there are things that, you can't just set and walk away. That person with mental health challenges really needs to know that you're their partner. And that's actually what makes all the difference, I think, in success with clients that have mental health issues, because the system is totally opposite of that. The system throws a solution at them. It's probably not necessarily the best solution for them. It doesn't end up being successful, and then there's nothing. So at least with a care manager, you can hold their hand a little bit through that process. You can really help show them that somebody believes in them, and that you're going to be there. You're going to be there with them throughout that whole journey. And I would say, the same is true with any population. I think that's why care management is so fun, because you can actually see the success of your work. But in mental health, it's definitely true. You definitely get to be a little bit more up close and personal. So
I think that's what's really special about the care management professional and their role, is that they can really align with someone. And like you said, kind of be that partner, really provide that level of support. In my own opinion, I feel like the professional care manager is underutilized in the mental health arena, and that we would maybe see better success or engagement with the, improved health management, just by having that extra layer of support that we can provide using that holistic framework. We can knock down some of those variables that other people aren't really seeing, because they aren't able to take the time to use that holistic methodology of really understanding all the impactful variables of that, person's life. Anyway, we could probably talk for a long time just on this topic. Let's go ahead and get to the next question. The contribution you made to the Life Care Management Handbook discusses the nonprofit model, which helps to address the limitations many have in being able to afford a private care manager. Can you explain some of the ways a nonprofit model can work to serve vulnerable populations, or our typical client that we serve?
Sure. Well, so, I mean, unfortunately, I think, in care management, oftentimes it's limited to people that have resources. But as a social worker, I certainly am near and dear to my heart are serving people who don't have resources. And so nonprofit is really the best way to do that, I think, and you're going to talk, you're talking about a majority of people, I think, who don't think they can afford care management. Now, granted, I think there are some people who are in the middle, and they probably could, it would be worth their while to have a care manager involved, at least on some level. But when you look at like, the people who are readmitted frequently to hospitals, the people who are in that never ending cycle of illness, where they never seem to actually get better, or they don't have the same health outcomes that other people with resources have, those are people that, they need attention, and they're a huge draw on resources in the healthcare systems. And yet the healthcare systems don't understand that if you give them that much more attention, that there's actual success that can come out of that. But unfortunately, in a nonprofit, you have to go the nonprofit model in order to have grant funds, donated funds to help them. And it's a challenge, for sure, but I think that it's the best way to probably serve people on a long-term basis, and actually track your outcomes and have partners in that process. So. Oh, you're back.
Sorry. What advice do you have for anyone interested in establishing a practice using the nonprofit model?
Do your homework. It's a daunting task. I can admit that it can be a lot more complicated than people realize. There's, in terms of just, the nonprofit model, and doing some of the initial applications and paperwork, I think that's probably the easy part. To me, some of the biggest challenges are you have to work with a board. You as if you start the care management practice in nonprofit, you don't really have any decision-making power. It's the board that has decision-making power. So your goal would be to then be able to work with that board and, really see that goal of, or whatever your vision is for that company, that you can hope that the right people are on the board. They're going to show up, they're going to vote, they're going to, have ideas and energy towards your mission. And that's a challenge. Sometimes it takes a while to get the right people. Also, I think that, in terms of in a nonprofit model, you got to be able to raise funds. And not everybody is built to be a fundraiser. So you need to make sure you're partnering with the right people, with the right grant writers, to really be able to fund it. Because otherwise, your vision and your mission go nowhere. You need to have that money in order to serve others. So it's challenging for sure. It's a lot of different factors that you can really, as long as you have a real heart for, doing it, I think you're driven enough to do it. But I think that it definitely comes with its own set of challenges that, say, a for-profit business doesn't necessarily have. So.
And you've obviously found success being the founder of a busy care management practice and having a team of professionals who work for your business. And where do you see the future of care management, especially as it pertains to social workers?
Well, I think it's a growing field. It's going to continue to grow. We have an elder population that's growing and growing. We have a mental health population that's growing and growing. I think you have also a number of professionals who are in healthcare roles that aren't satisfying. We saw a lot of that through the pandemic. So I think, for people who want to have a sense of actually helping people, care management is the future of their practice. And if you have even the slightest amount of experience whatsoever, there's a lot of mentoring that can occur within our professional organizations. It's a nice way to help people the way they want to be helped. So I don't see it doing anything but growing through the years. I know just here in St. Louis alone, 10 years ago, we had like 6 or 7 care managers. Now we have like 35. So, in these companies and, single practitioners. So it's growing and and as it should, because it's, I think, a more effective way of helping people.
Mhm.
Oh, amazing. I mean, I just feel like I could listen to you talk for a while and on this topic and just continue to engage in it, because there's so many great points you brought up, not only about our profession and the opportunities, but just giving that other sense that there's another model of practice outside the private pay where, we know where this industry is going to go. We do need to come up with solutions for how we're going to reach those that have lack of access to our services for whatever reason. So thank you so much for sharing all of your information and your wisdom again. I want to let our listeners or viewers know how they can best reach you and learn about your team. So would you like to go ahead and share how we can learn more about your company and
Sure.
maybe connect with you if they want to?
Yeah. So our website is www.carechoicestl.com. You can always call us on the phone at 636-288-1764. Or feel free to email me at maria@carechoicestl.com. I'm happy to always, be a resource to people if they have questions or if you're considering going into care management. It's a great field.
Well, thank you
All
so
right.
much
Thank you, Maria.
thank you so much for everything that you do. And, I love how you said that we get to care for people the way they want to be cared for. That really stands out to me here as we conclude our interview with you. So, Shauna, do you want to share with our listeners also where to get the book if anyone's interested in learning just in that particular chapter on the nonprofit model, or just to have this wonderful resource that we have available to you? Shauna can share where to find that. And then we
Yeah,
can.
if you go to lcmexpert.com, you can have specific classes, a whole series of classes on how to do care management. You can purchase the book, forms. So we have all kinds of resources on there to start your own business, or if you already have your own business, just different resources and classes if you need, just to fine tune some areas to help you become successful.
Okay, well, you guys have a great rest of your day, and hopefully you're having some sunshine. I know the snow is still coming down as I speak, and the power is still out. So thank you for joining me. I'm glad I could work out, and my cellular hotspot stayed the course. So didn't want to miss this opportunity with you, Maria. Really appreciate it. Take care.
Yeah.
Jennifer, Shauna, thank you so much. It's good to see
Thank
you
you
all.
guys. Thanks,
All right.
Jennifer.
Take care.
All right. Bye.